transplanted PRP. None has been effective, and finally I thought I used to shave my head and tie a bandana, and I did it for 4 years. मतलब कुछ भी फालतू का, I don't want to waste money on it.
Right.
Because ratherly, if age is a hair transplant, then why I have to do so much of topical solutions or unnecessary चीजें जो body के अंदर डालना है. I choose to stop all this. I just focused on my body. And मतलब अभी लॉकडाउन में मैं थोड़ा वेट पुट ऑन हो गया.
जिम किया.
हाँ जिम किया था. एक्सरसाइज किया था. And I used to keep my beard very long till here. And I shaved my head totally. And I wear a bandana. To give a new adult Punjabi look.
Punjabi look? I thought Socrates look.
No sir.
Socrates, the great philosopher with that long beard and empty head.
And I used to maintain that. बीच में I used to focus, मतलब तब तक मेरा फोकस एक ही चीज में नहीं बैठ रहा था because of this issue. And from when the body get into the perfect shape, I started focusing on things. And उसके बाद I just wanted to make the confidence inside me to pull more than towards 100%. I was trying to it. And what should I do? And finally I choose.
So tell me something. I'm interrupting you in between.
Yes sir.
This story many people tell me.
Yes.
I want to know the hidden story. Hidden story is what did other people tell you about hair? See, you became concerned about your hair loss.
Yes sir. Yes sir.
So first thing, it was not you who were to blame for your hair loss.
Yes.
Right?
Yes.
Now you are a bald person, a person turning bald in a society whose most people don't lose hair.
Yes.
Especially ladies. So what was their reaction and how did you include that in your life? Because a lot of time I have heard that they say no, nothing. Elect. No need to grow hair. That's enough. It's all right. Did you have any hindrances because of that?
Because of the doctors or from the...
No, from people
from
around
people,
you, from your friends. If he had hair all over his head, he would be telling you, why are you going for a hair transplant?
That I will show you. This is the perfect thing I know. And I said to my father,
surgery करने जा रहे हो.
Yes sir. I just want to share the conversation between my father and me, not just with the other people. And उन्होंने पूछा बेटा ये होता क्या है हेयर ट्रांसप्लांट. मैंने ये बताया पापा मेरा 15 दिन में हेयर ट्रांसप्लांट प्लान हो गया. मैं आपको I just wanted to inform you something. मैंने पूछा मतलब जैसे मैं क्रीम लगाता हूँ तो कुछ टॉपिकल सॉल्यूशन लगाता हूँ. उन्होंने ये सोचा कि हेयर ट्रांसप्लांट सर्जन ऐसा ही होता है क्योंकि उनको पता नहीं. He is aged 58 years and he is having no hair fall issues. So इनको जानना जरूरी थोड़ी है हेयर ट्रांसप्लांट क्या चीज होती है. And I have shown him a video from YouTube, some randomly hair transplant live. And they did some incisions. They have taken all the grafts and एकदम लाल हो गया बाल. And उन्होंने ये देख के and मुझे बोला कि that is a very funny thing. बेटा कुछ पैसे दे दिया आपने. पापा एडवांस तो देना ही पड़ेगा. ठीक है वो छोड़ दो, भूल जाओ, तुम मत कर. तुम हेयर ट्रांसप्लांट मत कर.
नासी इसीलिए आप पूछ रहे थे ना मेरे को कुछ शॉर्ट्स चाहिए करते हुए था.
हाँ सर. That is the reason
it looks much more risky than what it is.
Yes sir.
खून दिखते ही इंसान को हो जाता है ये तो हो गया. One thing. Second thing is कि कोई चीज करना क्यों है जब को तुम्हारे लाइफ को नहीं होगा प्रॉब्लम है ना. वो लाइफ को प्रॉब्लम होता है because this becomes an emotional issue.
Yes sir.
And which you rightly said, people who have hair don't tell you this thing.
Yes.
When you had hair, you had a hairline.
Yes.
You remember that hairline?
Yes. It's still in my head.
Most people don't remember it. No. So, did you want to, when you first thought of hair transplant, did you thought you will get everything back? Or what did you think? You'll get some hair back or what?
Yeah, I think from 2017 I was on this research on hair transplant. क्या चीज होती है और DHT क्या चीज होती है और 5 अल्फा रिलेप्टेस क्या होता है और ये सब हेयर हेयर फॉलिकल में कैसे इम्पैक्ट करता है और हेयर कैसे झड़ जाता है।
ठीक है,
तब तक मैंने
ये पढ़ लिया,
ये पढ़ लिया था।
तो मेरे को बताओ अभी।
हाँ सर।
इसके बाद दवाई खाया कुछ?
हाँ सर।
फाइनास्ट्राइड?
हाँ सर।
कुछ फायदा हुआ, कुछ नुकसान हुआ?
मतलब आपसे मिलने के पहले ही मैंने मेरा रिसर्च से 2 क्लिनिक्स मैंने चूज किया था from the various hair forums because of some n number of reasons. I have choose 2 clinics. One of which is
नाम नहीं देने का जरूरत,
हाँ,
कोई बात नहीं, ऐसे बता दो, ऐसे क्यों देना।
एंड पहला और दूसरा क्लिनिक था। आजकल पूरा ऑनलाइन का जमाना है, ऑनलाइन कंसल्टेशन पे ही गया था। एंड उन्होंने बिना देखे, बिना फोटो देखे, फोटो देख लिया था, मतलब वीडियो कंसल्टेशन हो गया एंड इन डिडंट आस्क फॉर एनी अदर टेस्ट। उन्होंने ब्लाइंडली बेटा 1 महीने तक 1 mg फिनास्ट्राइड हर रोज रात खाओ और उसके बाद फिर हम मिलेंगे ऑनलाइन पे और उसके बाद हम प्लानिंग करेंगे हेयर ट्रांसप्लांट का करके। आई थिंक आफ्टर 1 month, till 1 month I hate them. मतलब मेरे तो यहाँ से लेके यहाँ तक एकदम पूरा, आई थिंक इट्स माय काइंड ऑफ पैटर्न इज डिफ्यूज टू द एक्सटेंट व्हाट आई अंडरस्टूड फ्रॉम द पैटर्न्स ऑफ बॉडीनेस। यहाँ से यहाँ तक थोड़ा बहुत ग्रोथ हो गया, थोड़ा। ओके, जब झड़ने वाले थे मेरे को पता है, क्योंकि मैं उसकी ये सजेस्ट करने के पहले भी मैंने खा चुका हूँ फिनास्ट्राइड, और मैं फिनास्ट्राइड यूज किया हूँ, मिनॉक्सिडिल यूज किया हूँ। एंड मेरे को ऐसा फीलिंग आ गया कि अब आप है सर, आप ऐसा कुछ भी चीज यूज नहीं करते हो, आपके हेयर में जो बाल ऐसे ही है। एंड मेरा फीलिंग है कि मुझे भी बाल अननेसेसरली आर्टिफिशियली मेरे ऊपर नहीं रुकना चाहिए, दवाई से नहीं रुकना चाहिए। दे वांटेड, आई जस्ट वांटेड टू बी नेचुरल, आई जस्ट वांटेड टू लुक माय हेयर नेचुरल ऑन माय हेड लाइक एवरी अदर एल्स। सो आई स्टॉप्ड एवरीथिंग एंड आई जस्ट शेव्ड एंड हैड।
तो कोई क्या दिक्कत हुआ क्या, क्यों नहीं खाया दवाई और पढ़ाई कुछ दिक्कत हुआ क्या, जो आप बोल रहे हो ना?
हाँ, रिगार्डिंग द फिनास्ट्राइड, हाँ दिक्कत मैंने नोटिस किया था सर, टू बी जेन्युइनली पर्सनली। अब उसमें जो जो डिफेक्ट्स है मुझ पर ऐसा को तो मतलब टेस्टिकल में थोड़ा पेन होगा वैसा कुछ तो नहीं एक्सपीरियंस महसूस किया था सर। बट लेकिन उसके ऊपर जो बात फैल रहा है इसके लिए मैंने छोड़ दिया। जब ये सब होने के बाद मैंने फाइनली आपसे मुलाकात हुई है एंड वी हैव ए ग्रेट कंसल्टेशन फॉर आई थिंक द वेरी फर्स्ट मीटिंग वी टॉक्ड ओवर द फोन फॉर 36 minutes आई थिंक, and of which one sentence you have uttered, I just wanted to remember for that sentence for lifetime. I never suggest finasteride to my son, either to any of my patients. And that went so deep in my mind.
And so good. So anything which your doctor will not take for himself, why will he prescribe?
Yes.
So that is it. True.
उनके ऊपर ऐसा ही बैंड है। मैंने गया without no shame I asked him, sir,
transplant,
if you get the transplant from where you get the transplant.
नहीं तो लोग बहुत शर्माते
हैं। हाँ ठीक है सर, I understood that ये चीज है। yes of course for good aesthetics I know some, मतलब अभी तक मैंने देखा है इसमें 2 category of people. One especially for the marriage looking guys and 2 like him and me. अगर सुबह उठ के मिरर में देखा एकदम अच्छा फील होना चाहिए and we fall into that category. और जो पहला वाला कैटेगरी है ना सर, they don't understand the value of this donor. इनको 10 रुपए में चाहिए, 5 रुपए में चाहिए, 15 रुपए में चाहिए। they don't value, मतलब उन लोगों को पता ही नहीं होता है हेयर ट्रांसप्लांट मतलब वो क्या होता है, कितने घंटे का सर्जरी होता है और हाउ पेशेंट्स द डॉक्टर्स शुड कैरी एंड इट्स अ टीम वर्क। मतलब उन लोगों का
साइकोलॉजिकली आपका कैटेगरी, जैसे एक कैटेगरी तो होता है ना कि नहीं उग जाता है बाल, हम भी उगा लेंगे, नॉट रियलाइजिंग कि इट्स अ वर्क ऑफ आर्ट। घड़ी खरीदना है, सबसे सस्ता घड़ी खरीद लिया, टाइम ही तो बता रहे हैं, तो फिर दूसरा रोलेक्स क्यों खरीदता है? तो एक वो अफोर्ड कर सकता है, दूसरा उसको मालूम है कि फर्क क्या है दोनों में। तो मैं बताता हूँ, मेन चीज तो एक होता है कि शेर, बब्बर शेर, अगर वो एक दिन उठे और देखे कि दाढ़ी गंजा हो गया, तो क्या वो सीरियसली बोलेगा मुझे फर्क नहीं पड़ता, मैं एक्सरसाइज कर लूंगा, मैं शेर हूँ? नहीं, तो ये भी तो अपना हीरो वाला शेर का ही तो है, मुकुट ही तो एक तरह से हुआ। और जब चला गया तो फीमेल्स बोले कि कोई फर्क नहीं पड़ता, फीमेल्स यूजली नहीं बोलेंगी, नहीं, वो बोलेंगी कि क्या नहीं शेव ऑफ करके आ जाओ, फिर हम कॉफी पीने जाएंगे, ना बोलेंगे, कभी नहीं बोलेंगे। सो टू ऑल दोज पीपल हु से कि हमको फर्क नहीं पड़ता, एंड ऑल दोज मैरिड पीपल हुज वाइफ से कि हमको फर्क नहीं पड़ता, आई थिंक इट शुड बी टोल्ड ना कि लड़कों को भी फर्क नहीं पड़ता अगर आप सेम ड्रेस में हर फंक्शन में चले जाओ। So it makes a big difference, and the easiest way to remember is what happens to a bubber share. You are also a lion. Remember that. And humans में ये muscles के बाद यही तो एक चीज है जो लुक देता है।
और ऑब्वियसली यार सर, आपने जो एक पिकअप लाइन दे दिया, फर्क नहीं पड़ता, and this pickup line has been a pickup line for many people, even from corporates.
Yeah.
They'll say this one. But obviously, the way you look, the way you speak, these two will differentiate a person to the very great extent. In that case, with my previous hairline, even if just now as you said, if I make a good body, nice 10,000 rupee wala shirt, एकदम बढ़िया से एकदम ड्रेस करके फिर भी गया था, मतलब इन द वेरी फर्स्ट लुक दे इग्नोर,
मसल तो अच्छा है,
मसल तो अच्छा है पर ऊपर कुछ नहीं है,
अंदर नहीं देखते ना दिमाग के।
हाँ,
लेकिन वो चीज रहता है हमेशा,
मतलब 85% फॉर द नॉलेज, बट फॉर द वेरी फर्स्ट टाइम दे लुक द एस्थेटिक्स ऑफ द पर्सन, दैट इज व्हाट आई बिलीव। एंड इसके लिए मतलब इस शादी होने के बाद कैसे, मतलब इंसान एक तरीके होना ही चाहिए। शादी के लिए हेयर ट्रांसप्लांट करना है, शादी के लिए वजन कम करना है, एंड फॉर मी दैट इज टू क्रैप। सर यू आर एट आई थिंक आई डोंट नो योर एज, 52 I admire to you sir, when I look your hairstyle or the way you carry your body, the body weight, मतलब ऐसा ही जनरेशंस को जब भी मतलब we are at 25, 26 and admiring at double the age of the person who in front of us.
Don't worry, give me one more year, you will admire me more. जब लाइफ है तो फिट होना है ना। I'll tell you one simple thing which I want to convey to all people. See, FUE hair transplant is a gift to humanity. Why do I say that again and again? This is hair loss is a thing which will happen to at least 25% of the population.
Okay.
Means 50% will be males and half of the males will definitely turn bald. And this is the simplest thing. We keep on putting surgery into this. It is just that you one day decided that I don't like all my hair being in this place, and you just called movers and packers by the name of Dr. A's clinic, told them just I want to move this hair. It's as simple as that, and it is nothing artificial also. It's not a wig.
Yes, it's my hair, my own.
This is your own hair. You have got it put here. The only crucial thing is that is your private affair. You are getting your hair put on that. Why should the public come to know? So for that, the doctor should be such that he should make sure that once it grows, your girlfriend is not saying, "ये वाला बाल कहाँ से आया?" She should be saying, "Yeah, you look beautiful. I don't know what you did."
Yes.
So that is why it is a gift. There is no other disease which is so prevalent except getting old.
Yes.
We'll get to that also later on.
Yes,
but
sir.
this is one thing which is why I say more and more people, men, they should understand about this. And what is most important to understand, which you will help your friends also.
Yes, sir.
How to make graft estimates.
Yes.
If there is anything which you can learn from this, that is, next friend you tell, okay, you are this bald, you will need these many grafts.
Okay.
No, that will be thing when you will become independent on your own feet and say, yes, I am the boss.
Yes.
So, अभी आपका कहानी कहाँ से शुरू हुआ? How did you start off?
My hair was so first thing I used was minoxidil. because my father took me nearest dermatologist. He prescribed me minoxidil. So what he told was, you need to use this for lifetime. So whenever you stop, your hair will go off because the hair came from this solution. It will go off immediately. Like he told, I used it around 2-3 months. Then again I stopped. So again slowly your hair is falling. Slowly getting bald in this area.
When did you come to know that there is something called hair transplant?
Hair transplant, I know about 3-4 years ago, but I don't know. It is like very easily available to us. Like I think I thought it was very costly.
Costly and complicated.
Yeah,
Something
complicated.
make change.
What will happen, we don't know. Like this type of, I know that cutting technique, they took skin and they took grafts.
the FUT.
So I heard about that first time, so I kept away from my mind. Okay, we'll take care of it about later. So first we will use this type of solution, then we'll manage for some time. Like later this guy only told me. I am previously also I was using minoxidil only. Whenever I want a hair, like if you want to go any function after 2-3 months, I use it to start minoxidil for 3 months. And again I give some break.
So it
like
used
that,
to help you, huh?
Like little thickness will be there, but it won't grow too much long. It will fall off after growing this much, but it will cover some area.
Good.
Like thickness in front, but it won't get any.
You won't go back to square one. Not like full head of hair. Just something back.
Yeah.
So that is good thing, no? In what way? As long as we can retain some amount of hair.
Yes.
That is very good.
Yes.
Because then I have something to work with. So then how did you start on? Did you not start finasteride?
No, sir, no.
Good. Skin thins, right? And once it thins, what will happen to all that hair root? It goes all crumbling up. That is physical damage also occurs apart from the chemical and genetic one.
Okay.
So there is no special things which is happening here except one situation. Some people lose crown hair first. So in their case, if you see the skin, you'll find it to be very thin. So one of the things which I suggest is, why not use hyaluronic acid and collagen supplements? At the same time, I'll also say this, that this area, everything will work as well as it will work for the hairline, whether it is transplant, whether it is PRP, minoxidil, or any other medicine. If you are a good responder, you will respond in the crown area also. If you are a person with an average scalp and someone puts grafts in that, if they are placed correctly, they will always grow. It's not that this area will not grow and this area will grow. It's that this area requires more of art in the mind of the doctor. This is a large area. The directions are totally 360 degrees. If you are just a person who can barely manage to put the root inside, you will not think of directions, angles, densities. So that is also a reason why many times some people say that okay, it will not work. It's not question that it will not work. One, they don't have enough grafts to really fill the crown. The crown will almost be a rectangle, whereas the front is a triangle, half the surface area. So they don't have the number of grafts, requisite number of grafts. If you had 10,000 grafts in every person, then you won't say. Then if the patient says, I want to fill this instead of this, then you say, go ahead. So right now, doctors are making decisions for patients. Whereas in hair transplant, and like in any cosmetic surgery, it should be patients who should be making decisions. If you want your nose to be straight instead of crooked, you will not go to a doctor and say, just make straight, do something for my nose, whatever you think. You will say, I want my nose like this. So similar confidence should be in all patients. They should be able to say, I know how many grafts I need. I know this is the hairline I need. So just I am coming to you, see my donor, now tell me, can you place the grafts? It should be so simple in every city. One doctor should be there. telling, because this is a day-to-day thing. It's easier than can I give you 6 packs?
No.
I'll just make you lie down, take out all the fat.
No.
No, I can maybe in theoretical way.
Theoretically, yeah.
But it will be painful. It will be a lot of liposuction and taking out. Nothing. This is not painful. Not at least not as painful. Very mild.
Very mild. Yes.
And discomfort. What is the discomfort? That I'll make you bald? Yes, that is I'll do. But in 7 days or 10 days, we'll have something which will last a lifetime.
Yes, sir.
It's like telling someone, okay, see, I'm thin. I want to become Arnold Schwarzenegger. I have only 2 days. I'll lie down for 8 hours. You will make me. I'll not do any dieting. I'll not do any exercise.
That won't happen.
Hair transplant, we can do that.
Yes.
Without you having to apply oil every day and do those medicines and all those things.
Yes.
So in that way, when you told your friend, today can you tell him how many grafts he will require? Supposing, I am saying hypothetically,
Yes.
okay, you have another nice, very wonderful friend like him who is also turning bald. Remembering which friend it is, next in line.
He has another friend.
So one thing will be there, he will be going to some doctor who will say, okay, you need n number of grafts.
नहीं सर आपको.
So will you be able to tell, okay, I think you will need this many?
Yes, sir.
So
I told him. One of my friend, मैंने ऐसे ही आप ही जैसा मैंने स्केच ले लिया और ड्राइंग करना शुरू कर दिया. मैंने इनको बोला था कि भाई तेरा ये वाला हिस्सा पूरा काली है, बीच में थोड़ा बाल है यहाँ पे, लेकिन वो स्ट्रांग है. मैंने उनको बोला ये नहीं हटाना चाहिए और यहाँ पे पूरा काली है. सिर्फ ये एरिया के लिए लगभग मुझे लगता है 7000 ग्राफ्स तो होना ही चाहिए. और जो आगे वाला हिस्सा है उसमें तो पता नहीं 6000 एटलीस्ट 6000, मतलब एकदम पूरा काली है. हेयरलाइन आना चाहिए, मतलब इतना पार्ट है सर. आई सजेस्ट
तो अभी मैं एक मैजिक बताऊं आपको, जो मेरे को इतना 20, 22, 25 साल के एक्सपीरियंस से हुआ. अब हर समय तो मैं नापता नहीं, ठीक है, ये भी देखते रहो स्केल से. तो माई हैंड इज माई मेजरमेंट. So this one which I measure from this to this is 15 centimeters and this to this is almost 7 centimeters. So 15 into 7. Similarly, this becomes equal to 4000 grafts at a good density. So if you were to compare your hand with me, we take precaution, but still, how much is it? Is it smaller, your hand, or almost same?
Little bit smaller. 1 inch smaller.
Right. Not too much smaller. So now, from this day onward, I am giving you a scale. Like Buddha. This is your 4000 grafts.
Okay.
This is your 2000 grafts, or whatever the size.
Yeah.
Right. As simple as that. You will be able to say and tell them.
No.
Instead of making complicated things like hairline and those things. Right?
Yeah.
So that's, I think, a very helpful thing, and I hope you will share your progress with everyone.
Sure, definitely.